Hi, this is Mrs. Han. I'm going to explain this lab called Antibiotic Resistance. And unfortunately, we won't be able to do this lab at home, but it's a pretty straightforward lab. And if you read it carefully, you should be able to see, based on some of the pictures of results that we've had in class, um, what, uh, what this lab is trying to show. So go ahead and read the scenario carefully. Staph infections are pretty serious bacterial infections in hospitals. So, so we've got some staph infections that are what we call antibiotic resistant and some that can be treated. So we're going to be looking at that and then go ahead and read the setup carefully to see what we're going to be plating in each part of our Petri dish. So it will go into detail right here, what's going to go into each section. And then you're going to be putting it on something called a culture broth, which is like kind of like a gelatin, but it has nutrients in it so that the bacteria can feed on those nutrients and grow quickly. So here it says what's in the patient culture broth. Um, Basically, you can just put nutrients to grow the bacteria quickly. Okay, and read carefully all the steps as if you were doing this yourself. Okay, and then you're going to be getting 2 penicillin discs if you were doing this lab, and you're going to be putting them on your patient samples. So one's going to go on A and one's going to go on B, and these are little discs with medication on them, and in this case it's penicillin, an antibiotic used to treat bacterial infections or staph infections. So we're going to put one on each sample, and then you're going to make a hypothesis to see what do you think is going to happen, what the purpose of the control is. We're going to incubate it for 2 to 3 days. And why are we doing that? Okay. Then we're going to pretend 2 or 3 days has passed, and we're going to be looking at our results. Now here you can see that the antibiotic seems to have killed the bacteria around it. So this is, it's called a zone of inhibition. So here's a smaller zone, so this antibiotic seemed to kill the bacteria. Here it looked like the bacteria were not killed by this antibiotic. So it looks like it's all the same bacteria. So there's different antibiotics that are being placed on here, and you can see which ones are effective and which ones are not. So now we're going to look at the growth on our plate and draw what we observe. So we're going to pretend this is our plate, and here's patient A, and here's patient B. Our results aren't as pretty as this one, and here's our control. So you can sort of shade in your results based on these, on this picture. I guess this was the best one I had, but you can see that the bacteria seems to be growing all the way into the antibiotic right here, whereas here there's like a little bit of a zone of inhibition. So this one seems to have been effective on patient B. This control area, we didn't put any bacteria on it, so it should be clean. I'm not sure what happened. It looks like maybe some bacteria kind of hopped over and started growing. But technically this should be clean. It is pretty clean. It looks like something just like got landed right there and started growing. And it looks like some of this kind of like moved over and grew. So it's up to you. You can put something on your control picture or you cannot, but it should be clean as long as you kind of explain that later, hopefully. Okay, and then you're going to answer the questions. All right, so I'm going to go ahead and include a link for these pictures if you want to look at them more clearly. These are the cultures that we put on there. Not that that's important for you. There's supposed to be 2 patients with staph infections. So, and then just to kind of show you a picture of what these nutrient plates are, these broth plates are. So basically I had to like boil up some broth that had different nutrients in it, and then pour them onto plates, and then they solidified like jello, like hard jello. Okay, so I hope that's not too confusing for you. I hope you can see which of these patients the antibiotic worked on and which one it did not. It gets pretty serious in hospitals if they're not able to find an antibiotic that's able to treat your infection. So then they have to go to stronger antibiotics, and that can be difficult on your system. All right, if you have any other questions, feel free to email me.